Hey, Dr. Marcus, how's it going?
Good. How are you?
I'm good. Thanks for carving out a little time for me.
Oh, thanks. You're here to teach me everything I need to know about senior pets.
Oh, I don't have to teach you anything, Dr. Marcus. I think you got a pretty good handle on this stuff.
Oh.
You do a good job. I mean, your Fit As Fido stuff, it's pretty good. You know, I'm the author of Chow Hounds, so
Okay.
I know who you are.
Yeah. Uh-oh. Now I'm in big trouble.
You are in big trouble.
Okay.
These questions you sent, I'm going to just rip them up.
Oh. Actually, I do want to know the answer to those questions.
Oh, okay, then I won't tear them up just yet.
Okay. So I will ask you my first question. I have 2 Wheaten Terriers. My oldest one is 7. And I always think he's like 2.
Right.
And every year it's like, wow, he's a year older. So
Right.
Wheatens are supposed to live between 12 to 15 years according, to all the statistics. I'm hoping for 18 to 25.
Nice.
Yes. But when do you consider a dog as a senior dog?
Right, and Dr. Marcus, this is where we've sort of had this shift over the past decade. Dogs and cats, the fact is, are living longer. And so as they've extended their life expectancy, so has our awareness of the changes that they undergo, be it from digestion, physiological, psychological. I mean, all of these things are changing. And so there's really been a need for a reclassification of what is senior and what's adult and so forth. I mean, if 40 is the new 30, then for dogs, 11 is the new 7. And that's sort of really, that's actually what we've kind of concluded. And so I Am Senior Plus is the first diet for dogs to address those needs at age 11 and above, because they are different. I mean, as an MD, the changes that occur with digestion of proteins in older humans, for example. I mean, there's lots and lots of research done. WHO has done, just decades of research on that one issue alone. Well, it turns out it's the same for dogs and cats. As they age, protein digestibility decreases. And this wasn't really known 20 years ago. I mean, when I graduated from vet school, nobody talked about this. It was sort of like, well, I guess it's that way for the whole life. Nobody really looked at it. Well, so what IAMS did was they took all of this decades of research, combined them into one formulation. They said, what can we do to address those changes in dogs that are 11 and older? They came up with one great, formulation, and it's again, this is new and innovative. For me, though, I mean, if you want to look at the numbers, 11 and above for the normal-sized dogs, less than 50 pounds, is now considered senior. If they're over 50 pounds, which, of course, yours are not, but they would be age 9 and older. For cats, of course, 11 and older. And this just is reflective of the current life expectancy.
Okay. So, what is it that needs to happen to the dog's food as they reach that senior period? Like if you were, making your own dog food for them, let's say, you need to replace proteins with grains, or what is it that needs to happen to make their food, more appropriate to give them the nutrition they need?
Boost the protein for starters, because as we've already mentioned, protein digestibility changes as pets age. It's really an issue in older cats. So this becomes a big concern when I'm dealing with 19-year-old kitty cats that are starting to lose muscle mass. The second thing I would do for older pets, and I mean, again, this is literally what they've done, is you'd boost the amount of antioxidants. And that is because we know that as we age, it's the cumulative oxidative stress that causes the damage, the changes. So I'd want to make sure that they boosted that, which they did. And in fact, the IAM Senior Plus formulation has double the antioxidant amount than their normal diet, which is pretty impressive. Obviously, vitamin E is going to be a major component of that. I'd also want to increase omega-3 fatty acids. Not, I mean, of course, I'm all about anti-inflammatory, but this is also going to help with skin and coat, perhaps with joint care. I mean, you know the benefits of omega-3s.
Right.
They also added L-carnitine in higher levels, and I think I'm a big fan of L-carnitine. I personally take it myself, but that's to promote lean muscle mass.
Have you started doing this now that, you're eating the IAM Senior Plus?
No, I'm not taking the Senior Plus, but I do believe in L-carnitine. Because once for humans, after age 35, you lose lose almost 1% of your lean muscle mass per year, so anything you can do to preserve that, strength training and L-carnitine is awesome. So same thing goes for cats and dogs. Exercise and L-carnitine helps. Also glucosamine and chondroitin, they boosted that amount as well to help with, the joints. We could go on and on. They added more beet pulp, more fructose oligosaccharides or FOS, the prebiotics, all these things to keep the gut healthy, but it's a nice combination, nice formulation.
Okay. And then if you had switched your dog from a non-senior food to a senior food, what would you expect the change in the dog to be like? Would there be a weight change or an energy change or activity change, or what sort of changes the person feeding their dog would you be looking for?
Yeah, and Dr. Marcus, I would say it runs the gamut, right? It'd be just like person, because often the effects of good nutrition aren't seen for many, many, many years. I do believe that you're going to see some dogs and cats have more energy because they're going to have higher protein. They may even gain a little more stamina or strength. So that could be, especially if they're on a really poor diet, as unfortunately many dogs and cats in our country are. But as far as, this isn't a miracle, this isn't a silver bullet. Moreover, it's really, a rapid fire assault on aging.
Mm-hmm. So in addition to changing their diet, there are other things that you would recommend to do with the senior dog to keep them healthy and vibrant and living with you as long as possible?
Yeah, I really got 4 major tips I think everybody should consider. One is mental stimulation. As pets age, we need to make sure we're teaching them new tricks, playing new toys, going out and doing different activities. One of the simplest things I tell all senior pet parents, dogs and cats alike, is to use a food bowl, a food puzzle, as their, feeder. Use that exclusively. People always say, that my older dog can't learn to use a food puzzle. They can, and you need to engage them. It's like learning a new language for people. You've got to keep the mind sharp. Second, change to a different diet. Life stage nutrition is sound science. Dogs and cats go through changes. This is another change we've identified at age 11, so I Am Senior Plus is a great place to start for that. Third thing is exercise. I can't say that loudly enough. All dogs need to be exercised 20 to 30 minutes a day. Cats need to be involved in some kind of play, 2 or 3 times a day for maybe 4 or 5 minutes. Just something to get them moving. And then finally, I would say, we want to make sure that we see our veterinarian. Too often people try to save a buck by not going to their vet, once or twice a year. Senior pets should go there twice a year. And what people fail to realize, and I know you see this in your medical practices, if we can diagnose a disease earlier, not only will we have better outcomes, but it's often going to be less expensive to treat. So, it frustrates me because so many pet owners complain about the rising cost of vet care, but often it's just us not paying proper attention and doing the right things at the right times. And, I deal with a fulminant, type 2 diabetic as opposed to a cat that was just, pre-diabetic. Big difference.
Mm-hmm. Now, my Wellwing has had problems, I guess actually since he was a puppy, with a joint issue, and has done real well with some added glucosamine and chondroitin. I was wondering, as dogs age, are there other supplements that you would recommend adding in?
Right, and that's one of the cool things about, using these life stage specific diets like I Am Senior Plus. They're going to add that. Obviously, a dog, as you've described, that's maybe got some arthritic changes, I would definitely encourage you to continue as you've been doing with glucosamine and chondroitin, but I would also talk to your veterinarian about adding even additional omega-3s. The joint benefits there are really significant. So if you're feeding a good diet like I Am Senior Plus, and you're boosting it to help with an arthritic condition, that's about as good as you're going to get before you start adding an NSAID.
Okay. And then are there exercise restrictions that you can have in an older dog, or really the dog can continue to do their exercise as long as they don't, have other health problems that they've developed?
Age is not a disease, so I don't want to start restricting activity based on a date on a calendar. Obviously, each person knows their pet best, and some dogs are going to scale Mount Everest when they're 14 years old, and others can barely get off the couch. But having said that, physical activity can be maintained well into our old age. I am an Ironman triathlete, and I have plenty of friends that are, in their late 70s that are still completing Ironmans. Same thing for our dogs. And that's where nutrition becomes so important. And I'm really proud of companies like IAMS sort of looking at what's needed out there and filling that void. Certainly, these are big companies, and they're here to, produce products to make money. But more importantly, they look at the science and they say, this is what makes sense to us, and we think that this would be beneficial to pets. And I like that.
Yeah, it's interesting because pretty much everything you're saying is sort of the same thing that you need to do with seniors getting older, and all the studies show that, the mental stimulation, the improved nutrition, all of those things, are so essential for seniors as they age too. So I guess it's true whether you're human or whether you're a dog.
It really is, and I think that's the cool thing about, the two disciplines is we're really, we're starting to integrate and realize we can learn a lot from both sides.
Right. Well, any other great tips for me?
Well, the one thing I guess, it hasn't been widely announced, but I think it's pretty cool, so I'll share it with you. It's not part of the message, but in April, Facebook, on their IAMS Facebook page, they're going to start to have all these cool contests. And I saw some of the prizes, and again, I wish I was eligible to get them. And so some of your readers may want to go ahead and make sure they like that page or whatever. But in early April, you're going to see more around this message, but your readers can get a little head start if they'd like.
Okay, very cool.
Yeah.
See, now we just need to get you to throw one of my Fit As Fido books in with each of those bags of IAMS food, and we'll be good to go.
Yeah, well, I've got dibs on chow hounds first, so.
Yeah, so we can do them both.
Well, hey, I like that idea. I'll ask the IAMS people.
That's right. All right, well, it's been great chatting with you.
Yeah, thanks for your time, and thanks for all you do. I mean, you do a good job out there, and certainly I like the fact that you're, helping both sides of the leash. I really do appreciate that.
Yeah, I think, it's always, it always amazes me. People always say, I do anything I could to make my dog healthier. It's like, well, if you exercise your dog, they're going to be happier and healthier.
Right.
So please, get out there, move your dog, move yourself. And, sometimes it's hard for people to get themselves motivated, but I think having that connection with your dog is just such an easy way to get yourself as a human healthy too. And unfortunately, we have an unhealthy human and an inactive human. We have an inactive, unhealthy dog too. So it really works both ways. And I think too, sometimes people are able to look at what they're doing for their dog's nutrition and say, wow, I'm really focused on these healthy things for them, and then they translate that to themselves too. So
right, that's right.
It really, really works both ways. It can really be a two-way street.
Yeah. All right. Well, thank you so much for your time.
Oh, thank you.
All right. Bye.
Okay. Bye-bye.